In 2010, a combined 389,000 breast reconstructive and breast augmentation procedures were performed in the United States by board-certified plastic surgeons. Breast augmentations and reconstructions, whether congenitally based, cancer-related, cosmetic, or otherwise, are very important to our patients. With an entire section devoted to breast procedures, techniques, and innovations every month, the breast is very important to PRS as well. In the February 2012 issue of Plastic and Reconstructive Surgery, we take a closer look at both breast augmentation and breast reconstruction. First, join us in our online exclusive Baker Gordon video gallery as we learn about a new breast technique from one of the modern masters. Join Dr. Roger Curry in the lecture hall as he details the clinical and scientific basis for autologous fat transplantation in both breast augmentation and breast reconstruction.
I was impressed by how you could generate tissue by pulling on it. So what could we generate or enlarge the breast by just pulling on it from the outside? So I developed the Brava device.
Then you have the privilege to scrub in with Dr. Curry in the OR and watch him one-on-one as he performs his procedure from beginning to end.
You feel it giving. And I advance a skin flap to close a wound. I didn't expand on that, of course, but instead of doing a transposition flap now, that's how I close my wounds without undermining.
To get a better understanding of the importance of what happens after breast surgery, I urge you to read this very interesting paper, The Breast Q, a patient-reported outcome measure for cosmetic and reconstructive breast surgery, can potentially revolutionize how we as surgeons understand the results of breast surgery from the patient's point of view. Now here is senior author and Breast Q co-developer Dr. Andrea Pusick for more on this important tool.
Thank you, Dr. Orange. The inspiration to develop the Breast Q came out of the recognition that as we've continued to advance and innovate in our breast surgery techniques, we also need to advance and innovate in the way that we measure outcomes, and that the outcomes that matter most to us in breast surgery are patient satisfaction and improved quality of life.
Thank you, Dr. Pusick. I encourage each of you to join Pusick and her team as they study the 817 completed questionnaires to determine the validity of the Breast Q. In the years to come, our patients will continue to desire and need our skills in the area of both breast reconstruction and augmentation. It's indeed critical that we be prepared to understand and meet their every need. To keep abreast of what is the best science in our field, we must continue to watch, read, and learn plastic and reconstructive surgery.